Our department has grown tremendously in the last 10 years, not just by sheer volume of providers in the department, but also from a diversity standpoint.
One thing I noticed is that the residents had a great sense of camaraderie. They actually liked each other, and then I also saw the way the faculty interacted with the different residents. I saw that there was a very collegial environment.
Because of its long-standing tradition as a program of excellence, as a top program in the country, the University of Cincinnati was really the only school on my list.
I was looking for a smaller program, and I knew that after speaking with this faculty and staff that they really were invested in each and every one of their residents and would be able to mold me into the physician that I always dreamed of becoming.
I was pleasantly surprised by not only the family-oriented mindset of this program, but the respect that I was given even as a medical student.
I took a look at Cincinnati. I saw that the department fostered a good learning environment and also served a diverse population. See, we have patients come from all walks of life, and that's somewhere that I wanted to be.
If you look at UC Hospital, we are a level 1 trauma center, the only one in the area, and we see a diverse group of patients. And I think patients will feel a lot more comfortable and safe when they have team members that look like them.
We want to be able to be culturally sensitive to all our patients that we see here.
We have to recognize that we're not just treating a disease, but we're treating a patient. In the perioperative period, when somebody's coming to the operating room for a surgery, it is crucial that we understand not just the disease process, but the situation and the environment that led that patient to either develop that disease process or come to UC to begin with.
If you are able to better understand your patient and respect your patient, you're able to provide them better care.
As physicians, we take an oath to treat everybody equally with respect. I think it's critical to make sure that everyone feels that they're in a safe space whenever they're in our care or anything like that. I think making people feel comfortable is what we sign up for when we go into the field of medicine.
We have to be comfortable with caring for patients who may not look like us, think like us, act like us, or even share the same experiences as us, but we need to be able to provide them with high level of health care and make sure that we are always meeting their needs, whatever that may look like.
Having a diverse workforce helps build that foundation, and it's how we learn about each other, and especially our patients who are at their most vulnerable state.
They come with their own cultures, and if we have healthcare professionals who don't understand that, this can lead to greater disparities in healthcare, or even just a misunderstanding when it comes to patient-physician relationships.
With the population that we serve, we have to really be cognizant of that.
We've expanded, so we not only take care of the sickest of the sick and the poorest of the poor, but we take care of people from all walks of life. And we do the most complex stuff anywhere in the region. It's every bit as complex as what I was used to in the Harvard system. And I love the people.
And we are really trying to strongly foster a pipeline into our profession in order to increase the diversity of the workforce in the nurse anesthesia profession.
I certainly feel welcomed at the University of Cincinnati, and I'm proud of the efforts of our program, from its program director on down, to really introduce, communicate, and pack these really difficult but important topics.
This initiative is one that we really take to heart. It is demonstrated by individuals involved at all levels, from the student all the way up to the program director, and I hope it's one that you will get to appreciate soon.